Hey you guys, so this week we're talking about murmurs. So I like to break stuff down. I always tell you for testing purposes, when you are learning your murmurs, it's a lot to know, but you're trying to identify these and identify them quickly when answering a question. So I always say be sure that you know these three areas, right? Be able to determine whether it's systolic versus diastolic, know the location of the murmur, and then know the signs and symptoms and how it may sound, right? We'll get into murmur grading a little bit later. I already have a video for it if you want to listen to it, but we'll do that a little later. Right now, I just want you to get the foundation, okay? So what is a murmur? A murmur is just strictly something, additional sound that you hear, more like a whooshing sound. It sounds like whoosh, 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 as the patient's heartbeat, due to there being some changes in blood flow, right? Typically like a harsh blood flow for whatever reason, being some type of stenosis or regurgitation, right? And so that's where you hear that whooshing sound. And then you hear that at different grade levels, 1 through 6, based upon its grade, okay? So that's what a murmur is. Now, breaking down what category it is, how to identify it, where it's located, etc., right? So then systolic versus diastolic. When we're thinking about anything systolic versus diastolic, like blood pressure, etc., we need to know how you identify it. It's the same, right? So systolic is how the blood flow is exerted from the heart, right? Now diastolic is more so when those when the muscles relax and the blood fills into the heart, right? Okay, so when we're thinking of murmurs, same concept, systolic and diastolic, okay? So those systolic murmurs are your mitral regurgitation and your aortic stenosis. And my mnemonic that I say, my Britney's brilliance, I say, men really are stupid. That's my sassy systolic, okay? Men really are stupid. Men really, MR, being mitral regurgitation, are stupid, AS, being aortic stenosis. And then diastolic is the opposite, right? So mitral stenosis and aortic regurgitation, right? All right, so now that we know which fall into the systolic and which fall into the diastolic, let's understand what they are. I like to tell you, start with your medical terminology so it helps you to break it down. So regurgitation is causing us to go backwards, right? It's regurgitating back into the blood flow back into the heart instead of flowing into the arteries as it should. And then stenosis means narrowing, right? So no matter systolic versus diastolic, it's going to be the same concept, no matter if it's aortic or mitral, same concept, just with a different valve, right? So with our systolic murmurs, our mitral regurgitation is there's an error with the valve. That mitral valve is not closing as it should, so the blood flow is what? There's regurgitation, so it's backing up, okay? So that's where that murmur is, you're hearing that murmur when the heart beats, because that blood flow, you're hearing it come back instead of just flowing normally. So you'll hear it at different grades, that whooshing sound as the heart beats, because when it beats, it's not going through as it should and flowing through naturally, but it's coming back because the valve is not closing as it should. Whereas with aortic stenosis, there's narrowing that's causing the alteration in the blood flow. And then diastolic is, the opposite, just different valves, right? So we have our mitral stenosis. So now that mitral valve is narrowed. So the blood flow is changing there and it can't just go through adequately. And then the aortic regurgitation, the aortic valve is not closing as it should. And so it's allowing the blood flow to come backwards, okay, into the heart, okay? Now, those are just the basics. I know I didn't go... It can get a little bit more complicated and we can do more videos on that. But I'm trying to give you the foundation, but simplify it so that you're able to easily answer the questions, okay? All right, you guys. Next, I gave you 3 things. We want to know systolic versus diastolic. We want to know the location. So is it located, where is the aortic and mitral location is what I mean when I say location. And then the signs and symptoms like the sound, etc. We'll get into it. So now let's talk about location. So where is aortic location? Those aortic murmurs located. They're going to be at the 2nd intercostal space, okay? At the base of the heart. Whereas mitral is at the 5th intercostal space, mid-clavicular line, at the apex of the heart, okay? Now, tidbit I like to say, we're so used to base meaning bottom that it can get confusing. And I have a lot of review students that get confused with it because they are picturing the base being lower than the apex, but it's not. The apex is lower down. That's why it's at the fifth intercostal space, mitral. And so I say think A comes before M in the alphabet. So aortic, A, being at the second intercostal space at the base of the heart, and then mitral being at the fifth intercostal space at the apex of the heart, okay? And I know you're like, all right, Brittany, this is nothing, but it'll all start to come together when you're starting. When you see questions and you're starting to try to determine where it is, when you're using your stethoscope and you're listening, you will start to understand it a little bit better. If you can categorize them into these subgroups, you will be able to quickly identify what type of murmur it is, okay? So again, so we have our systolic and our diastolic murmurs, and now you know the locations, right? So systolic and diastolic being, and so let me kind of tie it together so you can better grasp what I'm saying. So systolic murmurs, we talked about it, you know. If you're still trying to get it down, and there's a lot of mnemonics out here, use whatever works best for you, create your own, whatever works. This is just something that came up and it helps me. This is what I teach my students with my brilliance. Sassy systolic. She's sassy. And she says men really are stupid, right? So men really, that mitral regurgitation, are stupid, aortic stenosis. So those are our two under that category that we are focused on for board purposes, right? So with mitral regurgitation and aortic stenosis, again, aortic is at the second intercostal space, the base of the heart, mitral is at the fifth, at the apex. So if you're seeing a question and they're telling you, you know, it's a systolic murmur located at the base of the heart or at the second intercostal space, whatever terminology they utilize, you're going to instantly start to think, all right, base, second intercostal space, that's the aortic location. So it has to be a type of aortic murmur that they're referring to, right? Then, they said systolic. All right, what did Brittany say? Sassy Systolic said, men really are stupid. So our stupid is aortic stenosis, right? So understanding these little tidbits will help you to quickly identify when they're giving you questions in this format. So this is for testing purposes, okay? And then likewise for the mitrals, you know, it'll say apex, fifth intercostal space. Or they might say mitral, they may say aortic. I'm just trying to teach you all of those areas so that you can identify it and understand what they're talking about. And then when you're doing it in practice, you also know how to identify what type of murmur you're talking about. Okay, so that's systolic versus diastolic, and then the location, understanding where aortic and mitral is located. So now let's move forward to the signs and symptoms, okay? All right, you guys. So now let's kind of talk about how they may present sounds, signs, and symptoms, okay? So with mitral regurgitation, it'll be holosystolic, or also you may see it as pansystolic. They may also complain of pain radiating up to the axilla region. Just thinking about it may help you a little bit better because mitral is located at the fifth intercostal space. So if it's going to radiate, it'll be closest to that axilla region to radiate, right? They may also complain of some shortness of breath, dizziness with that regurgitation. Now, mitral valve prolapse is the one that signifies with that click. You kind of hear that click because what's happening with mitral valve prolapse is that valve still is not functioning properly and not closing effectively, and it causes that area to kind of like bulge and prolapse. And that's where you'll hear that click sound. Aortic stenosis, there's more of a harsh sound, and they may complain of pain and radiation to the neck, to that carotid region, okay? Again, thinking about aortic being located at the second intercostal space, so it'll typically radiate higher, okay? So that may be a way for you guys to remember that. And then our last two, we have mitral stenosis. They will have, it's more of a low-pitched sound, and aortic regurgitation is more of a high-pitched sound, okay? A lot of these symptoms, they may have dizziness and shortness of breath across the board just because it's of the fluctuation of the blood flow, the regurgitation causing it to go backwards, and then the pressure changes. Okay, so they may have various symptoms with that, but take it on a patient by patient basis. I don't want to give you too many different variances to confuse you, because this is supposed to be more of a short and sweet term for my family nurse practitioners and adult GR nurse practitioners to kind of teach you how to quickly identify it when there's a question thrown at you, to show you how to look to see whether it's systolic versus diastolic, understanding aortic versus mitral in those locations, and then how the pitches may sound. And again, I do have another video for grading, and we can get more into that, but this is just for these purposes. So don't take it as far as the end all be all, because it gets more in depth. I just wanted to give you the foundation and a quick way to factor into those things, okay? And if you have any questions or concerns, or want me to explain a little bit more deeper into how these things function, or how they present, or you know, giving more examples, let me know in the comments, and I'll be happy to do so. All right, as always, meet me back here, but also like, comment, subscribe, and share with those who may find this helpful as well. Bye, y'all.